Namaste to all. To the continuation of the She Matters webinar series on the occasion of Women's Day celebration, we are here to discuss Ayurvedic secrets of women's health. I am Dr. Swapna, Ayurvedic physician from Wellness by Heartfulness. Today's moderator. We will explore the hidden wisdom of Ayurveda, a science that has understood women's health for thousands of years, from menstrual health to menopause and beyond. Ayurveda offers simple yet powerful secrets to keep women healthy at every stage of life. So, to uncover some of the secrets, today I welcome Dr. Sameera, an Ayurvedic physician by Wellness by Heartfulness. She holds a bachelor's degree in Ayurvedic medicine and surgery and a postgraduate degree in Javaguna from Dr. NTR University of Health Sciences. She has been working as a consultant at Wellness by Heartfulness since 2022, offering holistic and individualized Ayurvedic care. She has a special interest in women's healthcare, supporting menstrual health, hormonal balance, reproductive wellness, and overall well-being. Hi,
Dr. Swapna.
Yeah, hi. Hi, doctor. Welcome you on this webinar.
Thank you. Thank you so much for the introduction.
Yeah. Yes. Hi, doctor. Before we begin our discussion, I would like to start with a basic question for the benefit of our listeners. How does women's health management in Ayurveda differs from other medical systems?
That's a wonderful point to begin today's webinar. So actually, each medical science has its own approach for a certain health of maybe women or maybe children. So in the same way, Ayurveda has its own approach. So the focus mainly, it won't be only the symptomatic. So we treat like internally based on the doshas aggravated and based on the complaints of the patients. We just match it with the doshas and we try to treat it internally. So in this point, maybe all the systems may not be taking the treatment protocol in the same way. But Ayurveda, though, it helps to detoxify internally through maybe medications or other therapies and all. So this is the first major point from which Ayurveda differs, particularly in women's health. And the second featuring is Ayurveda focuses on each individual phase of the woman. So maybe it may be like starting from the menarche phase, how it should start, and what is the normalcy of the menarche, and what are the symptoms or doshas aggravated in the menarche, and how they can be treated in menarche. And after menarche, it comes the fertile phase. So during this fertile phase, how Ayurveda it can support in this particular phase to have a healthy progeny and then the postnatal phase, delivery and the postnatal phase, it can focus on. And then also finally, the menopausal phase is also a very big transition in the woman's health. So Ayurveda can guide in this phase also. And these phases will be interlinked. See, if you have a healthy menarche, the fertile stage will be good because if your periods are regularized, so it will be easy to conceive and also the progeny will be healthy. And if the fertile phase and the delivery phase is taken active care and all, so the next phase will be good. And if the hormones are imbalanced during this phase, the menopausal phase will be easy to go through. So in this way, like in Ayurveda, we focus in individual phases of the woman's life. So I think this is also one of the main difference in Ayurvedic system compared to other systems, and we can support in each and every phase of the woman.
Yeah, that's great, Dr. Sameera. What kind of situation should someone consider consulting an Ayurveda physician?
Yes. So as I told you right now, we can start journey from initiation of menarche. So during the irregular periods, the starting phase of menarche will be little irregular only. The periods will be irregular. It may be scanty also. That is quite normal. But if it extends to little longer period, that there you need to get concerned and we can help you in that phase. Okay, regular periods, scanty menstruation, dysmenorrhea, that is painful menstruations also. And for few, it may be very irregular with more either the flow may be scanty or also very excess, and prolonged menstrual period also will be there. So in that case also Ayurveda can help you. And the common conditions like ovarian cyst, polycystic ovarian syndromes, and the fibroid uterus. In these conditions also Ayurveda has a very good treatment protocol in that. And the next coming to infertility also, which has been like the common complaint in these days. So Ayurveda can help you in that also. And the perimenopausal and menopausal and post-menopausal phase also, Ayurveda can help you. So people who are having or prone to such stage-wise illnesses, or you can just approach Ayurvedic physician. We can give a good treatment.
Yeah, it's like very fascinating how ancient wisdom of Ayurveda still feels so relevant in modern times, right?
Yes.
So, doctor, like hormonal issues are one of the most searched topics, health topics among women today. So, regardless of age. So, in fact, we see many women walking into clinics with concerns related to hormonal imbalance. So, how does Ayurveda understand hormonal imbalance? Could you please explain?
Yes. So as you said, the hormonal imbalance, it's been the more main or the root factor for the other health issues also. So that should be taken care of. So how Ayurveda understands is basically we will understand it through the imbalances in the three doshas, which are the main guiding factors in the body, Vata, Pitta, and Kapha. So the imbalances in these three doshas, and for suppose coming to female health, if Vata is imbalanced in their body, so the symptoms may be irregular cycles or a scanty bleeding, insomnia will be there, and dry skin will be there, and also amenorrhea will be there. So this is Vata aggravated factors, the symptoms. And coming to Pitta, aggravated, it can be like intense symptoms may be there, like excess bleeding may be there, burning sensation may be there, and also hot flashes also may be there. This comes under Pitta aggravation. And coming to Kapha imbalance, it may be like conditions like PCOS may be there. So that will be due to Kapha aggravation, and the lowering of metabolism will be there. So lowering of metabolism, obviously, it will be positive factor for weight gain also in the body. And so water retention conditions will be there. So these will be like a Kapha imbalance. So imbalances in this indicates that some hormonal disturbance is there in the body. We need to find out what is the reason for that. And one more important factor for this hormonal imbalance will be Agni, that is internal digestive fire also. So Ayurveda plays an important role, or it treats Agni also a basic factor for this metabolism related issues, or simultaneously like hormonal imbalances also will be there. So generally the ama or the digestive fire in us, it gets reduced. It releases ama, that is a toxic byproducts. So these gets lodged in the body, and that will be a causative factor for the health issues. So in this way, like Agni is also will be contributing factor for hormone. We need to check how we can work out on it.
Yeah, that's a good Dr. Sameera. Like, can you like what are some daily habits that unknowingly disturb women's hormonal balance? Unknowingly, sometimes we do some unknowing things that we don't realize that this could be the reason for our hormonal imbalance or something. So, please explain some.
So basically, the unknowing things are known for many people, but we do those things. So those will be the most causative factors. Now you can understand. So first factor will be it comes like ahara related to food. So in these busy schedules and all, eating homemade proper food, proper timely food is becoming problematic. So people are more inclined towards outside foods or beverages and all. So that will be one of the first and most positive factor. So that is called like ahara hetu is a positive factor. So this intake of irregular foods or proper processed foods, beverages and all, it obviously again as I told you, Agni, it alters the Agni and decreases the metabolism, contributing to the hormonal imbalance. And the second factor will be Vihar, that is a daily regimen. So our ancient acharyas, they have given us the dinacharya, that is the regime to be followed once you wake up till you go to the bed. And these days, like very few people are following that. So going to bed very late and waking up very early, it alters the circadian rhythm also. So in
Yes.
this way, the disease. And the third one, the most prime important factor will be psychological, manasika hetu. So psychological, maybe it may be stress or anxiety, it may be fear, it may be sorrow, anything. All these factors also, which will be contributory factors for the hormonal imbalance. So stress also, like due to these days work or work timings and all, so we are not focusing on the mental health much. But it is one of the most important area also, which should be concentrated in mental health. So this will be one important. And the next is Vega Dharana, that is suppression of natural urges. We have in the classics Vega and Dhara. That is, there are few urges which we should not suppress. That is Vata, which flatters in the body. Bit, that is feces. Mutra, that is urination. Tavatu, that is sneezing. Throat, thirst. Kshuta, Akali, that is hunger. Nidra, that is sleep. Kasa, cough. Shama, that is fatigueness. The respiratory related issues. Jrumba, yawning. So these are the factors which we should not suppress. So once we suppress these factors, it will be like what aggravation in the body takes place, and it will obviously lead to. See, maybe you can experience in your own this also. If you once you suppress your hunger, obviously you feel a headache, right?
Yes.
Appetite.
Yeah.
If you don't eat on a timely basis, it will be affecting vata and imbalance, and it will lead to headache also. So all these factors should not be subsided. Coming to time concerns or what, we'll be postponing. We'll be having thirst. We'll postpone to drink the water. We'll be having hunger. We'll be postponing to eat food. So that should not be postponed. And also the last factor will be aging. So due to aging also, there will be like a decline in hormones levels in the body. That is quite natural. But if we are aggravating more symptoms, that is coming to menopause, it is a hormone decline of this. So if the symptoms are more aggravated, you can consult us. We have quite enough remedies to support you in your perimenopausal or menopausal phase. So these are the daily habits which I feel it will be affecting our hormone.
Yeah. Grossly, it is like listening to our body. Like whenever you are hungry, you eat. Whenever you feel
Yes.
sleep, you sleep. Like nowadays, even though we are sleepy, we will be like scrolling the mobiles and all. So it is grossly just listen to your body. When it needs rest, give the rest. When it is hungry, give the food. Right?
Yes. Yes.
Yeah.
Exactly.
Okay. Yeah. Doctor, you clearly explained like how certain daily habits and lifestyle factors can lead to hormonal imbalance, and digestive issues. Like as a doctor, I also feel sometimes like these some disruptive habits these days, which in long term may affect the fertility in young girls also. So like nowadays, many couples seem to be struggling with natural conception. So could you explain how Ayurveda supports couple facing fertility concerns these days?
Yes, coming to this infertility also, these days the cases have been drastically increased. The reason may be many, again, as I told you, the factors right now, it may be food or it may be the lifestyle or it may be the psychological issues. But the people who are facing this had been drastically increased in the few years. So Ayurveda can support in this also. So it should focus mostly like detoxification of the body. So that should be done as the prime most this thing to cure. And first thing we have to rule out the cause. Cause why infertility? Why it is happening? What are the reasons? So that should be focused, and accordingly, we have internal medicines to treat the conditions, and also detoxification or the purification panchakarma therapies that also can help you to relieve from the infertility situation.
Okay, Doctor, like, can you give some examples? Like, nowadays improving the egg quality and reproductive health and managing stress, like which is often plays a big role in fertility challenges. Like we see many people walking in clinics with fertility issues, even though the reports are normal and all. So, what is your view in this?
So, like coming to Ayurveda, there are four factors which we need to take care of in case of fertility. Okay, that is Rutu, Kshetra, Ambu, and Bija. As you know that Rutu, it is the fertile period in which the conception should happen. Okay, so that should be taken care of. Then Kshetra, that is reproductive system, that should be cleaned. Okay, like proper, healthy reproductive system. Ambu, that is bodily fluids or the nourishment part which needs for the conception, that should be good. And Bija refers to either ovum or sperm. The quality of ovum and sperm should be proper. So these all, as I told you, these can be attained by proper detoxification procedures. Like we can go with the Vasti procedures, Vasti and Viration, and also external therapies also like Abhyangam and Potlik massages and all. And for stress relieving, we can go to Shirodhara or Shiropichu therapies. For overall maintenance, we can also do our yoga or meditation or pranayama or whatever it is. So all these like together, it will be helping to conceive and also to maintain the pregnancy also. And we have like researchers proved also after actually these days many people are going for IVF also, right?
Yes,
So,
yes.
yeah. So in this IVF conditions also, before going to IVF, we can take a detox process, karma detox, which will help to increase the success rate of the IVF what we are running. So there are researchers on this also, because the body internally it gets detoxified. And obviously, the functioning of that improves. And whatever they organ wise, their functioning and all also, it goes in a proper way and proper rhythm. So,
Yes.
and this is like you can approach the infertility.
Yes, that's very insightful process to move towards a healthy pregnancy. Like in maybe in other systems, we don't find like healthy pregnancy, promoting healthy pregnancy and all. So Ayurveda has such a beautiful views in like promoting prevention. Like most of the views are like preventing and supporting the health. So it's great. And doctor, next important and transformative phase in women's life is pregnancy. So in today's busy lifestyle, many women continue working almost until their due date. So since this is such a crucial period that requires special care. So while working and all, we don't understand the importance of the phase and all. So what are some simple practical steps pregnant women can follow to maintain a healthy pregnancy throughout the 9 months?
So, yeah, simple steps in the sense, the biggest system, as I told you. I would like to tell few points on this, which basically we have to follow, but we are unable to follow. Okay, so these are like first step maybe eating easily digestible and fresh, warm food. So because fresh, warm food which is easily digestible, it doesn't affect your Agni. So the digestion process and all, it goes in a sync properly. And obviously, if digestion is proper, the nourishment for the fetus also goes through. So the first point will be eat freshly prepared and warm food. Then the second will be drink enough fluids. So your
Yeah.
body needs enough fluids also. Right? I told you Vegadharana will be not taking enough fluids. But this fluid point, it comes in the last trimester. So once your due date is approaching or you're approaching your pregnancy, the fluid inside, it gets declined if you are in the state of dehydration. So having proper enough water intake since your first trimester, it will really help you till your next, third trimester, till you approach your delivery date. So it's good to take enough fluids, whatever it may be, either it will be water or juices or any sort of other porridge type of things and all. So it's good to maintain your hydration levels. And then following a gentle daily routine. That is waking up early in the morning, making little stretches, and general care things like not overexerting yourself, not traveling long distances, maintaining proper rest and sleep. These are also to be followed. Okay, we have to fulfill our job, this, but self-care is also equally important. So one should take care of that. And the next is daily oil application. Okay, so daily massaging the preferably lower parts of the body, and also head massage. Head massage will help you to relieve the stress. Okay, makes you relaxed. And lower body massage also, it will help you to strengthen your lower body muscles. So which will ease the flexibility and also help you in your delivery. Okay. The next thing is maintaining your emotional well-being. And I think many cases will be there where mother feels lonely also. So she doesn't have anybody to express her feelings or sharing their thoughts. So in this aspect, family members should support her to share her thoughts and all. And one more thing is talking to your baby. So talking to your baby also, you just tell her what you're doing, where you're going, everything. Share everything to your baby. So it will also help to maintain a good bonding between your baby, and also makes you strong mentally. So it will make a good connection, and also if any loneliness or any anxiety related issues are there, they are drastically lowered if you talk to your baby. This is one of the important point which everybody has to follow in their learning. And the next is proper nourishment, month-wise nourishment. So you need to take care of yourself and also your baby inside. So proper nourishment should be there. And the next is preventing of constipation. Proper food in the sense it should be easily digestible, and it should not cause any constipation related issues. So generally eating more fiber-rich foods can help you. Drinking warm water also can help you. And also adding small amount of ghee also. Regular meals, that will also help you to prevent the constipation. And one more factor is sleep well. Adequate sleep should be there, proper rest should be there, minimum of 7 to 8 hours also. And 7 to 8 hours in the sense, few may sleep at 1 o'clock in the midnight and waking up at 7 or 8 in the morning. That is also not advisable. The 7 to 8 hours sleep is fulfilled, but it doesn't comes under quality of sleep.
Yes, doctor.
Sleep by 10 a.m. in the morning and wake up by 6 a.m. Sorry, 10 p.m. in the evening and wake up by 6 a.m. in the evening. That is good. And the last thing is regular checkups. You should not avoid your regular gynecological visits, which will help you to guide for your next steps or next months. So regular gynecological visits should be also done.
Yeah, some cautious small things can play a major role in baby's development.
Exactly. This is what many people will be missing.
Yeah.
Yeah.
They will think what sleeping anyhow. We are sleeping 8 to 9 hours, and we are eating food, but the time and the quality it does matters also. So, can you explain? Is there any simple dietary suggestions or that help support mother's health as well as the development of a baby during the pregnancy? Is Ayurveda has something special diet?
Yes, definitely. Coming to during the pregnancy phase, it can be divided like first, second, and third trimester, right? So based on the what things happen during the trimester, we have also foods what to be taken, how the food to be taken. So coming to first trimester, embryogenesis takes place during this first trimester. Hence, the body requires amount of energy during this period. This can be provided with milk products, like taking more milk products, that is milk, ghee, and also sweet foods. Sweet foods along with ghee, that will also help like a very good nourishment. And also coming to the first trimester, many may feel nausea and things. So yeah, this can be prevented by taking enough fluids, because this nausea and vomiting, it may create dehydration. Proper enough adequate fluids should be taken during this trimester, first trimester. And coming to the second trimester, here the muscular tissue of the fetus grows. So obviously, our food should be properly complementing or supporting that nourishment. So taking animal origin foods like meat, cheese, and butter. This can help you during this second trimester phase because it provides proper nourishment to the fetus and also helps in the muscular growth of the fetus. And coming to the third trimester, it should be like a proper maintaining of the body. So whatever you take it heartfully and avoiding all junk foods as I told you earlier, and taking a proper healthy processed foods should be avoided, but the processed foods with milk, maybe all the sweeteners, also sweet natural sweetening agents, those also can be taken, which will help you like a soothing and also nourishment purpose during this third trimester.
Yeah, that's great, doctor. If I connect the dots from your answers, all it's clear that Ayurveda understands a woman's health as a something deeply connected to her lifestyle, mainly,
Yes.
and emotions, food, and daily routine. Nothing special, or it's not a rocket science to maintain a health. So, moving on to the next question, doctor. Another major phase in women's life is the perimenopause and menopause stage. Like many women experience significant physical and emotional changes during this time. What changes happens in the body during menopause? Like when they should approach the doctor in the can I explain?
So menopausal is one of the most and the very big transition phase which I can tell. So few will be going through it very smoothly, and few will be feeling the symptoms very badly. Okay, so general symptoms though, if it is manageable or if the symptoms are not altering your daily routine, that's fine. You can manage it through your diet and lifestyle. If the symptoms aggravates or you need some help, then Ayurveda can definitely support you in this. Coming to the symptoms which generally women face during this menopausal. And actually, menopausal is the cessation of your menstrual cycle. Okay, it starts from around 45 and lasts for about 55 also. So the perimenopausal phase, it will start around 45. The symptoms may be very minute, like hot flashes will be there, anxiety will be there. So these will be the symptoms. Coming to menopausal phase, till your periods, this perimenopausal phase, your periods will be irregular and also scanty. And once you miss your periods till 1 year at a stretch, then you have entered your menopausal phase. During this, the symptoms may be little more also aggravated. So it may be like coming to Vata, the anxiety may be there, mood stress may be there, mood swings may be there, and hot flashes in the body may be there, irritability may be there, and low metabolic fire may be there, which will be reason or causative factor for your overweight. So these are the factors, and externally also coming to your skin, it will be like very dry skin will be there, wrinkly skin will be there. And coming to your reproductive system, as I told you, like the periods will be irregular or scanty. And then coming to your serious system, because the estrogen and progesterone levels will be very down. Okay.
Yeah.
And particularly estrogen, it is very low in the menopausal phase. It is one of the supporting for your heart also. So because it is a decline, it may also result in cardiac issues during the menopausal phase. And one more important thing is calcium decline will be there during the menopause. So mostly like osteoporosis or easily fractures, this also may happen during the menopausal phase, which we need to take care of properly.
Okay. Are there any simple dietary suggestions or some commonly used Ayurvedic herbs that can support women and help manage these symptoms as a part of their daily routine?
Yes, definitely. First suggestion I would give is start your day with fennel seeds. So you can make infused water of fennel seeds. So that will help you to reduce your hot flashes and also improve your mood also. Okay. And the second thing may be shatavari. Many people might be knowing this, right? Shatavari also will help you to balance the hormonal levels. in the body. And the third primemost, as I told you, people will be prone more to bone-related issues during this phase. Plain tila, sesame seeds, taken along with jaggery daily, maybe 1 teaspoon or 2 teaspoons. That will be helping you or supporting you very much to have a good bone health. And the next foremost important thing is ashwagandha. Ashwagandha also many people will be taking. If you take this on regular basis, it will help to reduce your stress-induced disrupted the hormones, helping you coping up with the hormonal imbalance.
Yeah. Okay. That was truly insightful, doctor. I am sure your advice will help many women who are listening today, and women go through so many important phases in life, and understand how to care for their health through each stage is incredibly valuable, right? To all our listeners, if you are someone you know is going through all these phases, whether it's managing hormonal health, planning for pregnancy, going through pregnancy, or recovering after childbirth, anything, this Ayurveda wisdom can be very helpful for them. I request them, please do share this conversation with the friends, family, or anyone who might benefit from these insights. And finally, doctor, one of the most loved topics among women is skin and hair health. Many of us very conscious about maintaining our healthy skin and strong hair. So how skin and hair health connected to our overall health, or how Ayurveda supports?
Yes, coming to skin and hair care, people they want instant results. So applying a face pack or applying a hair pack, instantly they feel your hair should be completely clear out of wrinkles and all that. And hair should be strong. You should get a very long hair and just want to sittings or any applications. So according to Ayurveda, that is not possible. So, because the reason will be our internal body should be good. Okay, so coming to skin and hair, it should go on like internal, supporting each system. So first and primemost factor will be stress. Stress should be normalized. If you have stress, obviously, though you take any internal medicines or you take an external application, that doesn't help anything. So you should find the ways where you can lower your stress level. And the second will be gut issues. If you have gut issues, proper nourishment won't be there, and that also will be affecting externally in the form of skin, grains, hair, or wrinkles in the skin, or dryness in the skin, and all. So in that case, you should focus on your gut health. If you give a good gut health, improving your metabolism, making your liver function proper, obviously that comes up from your face, increasing the glow in the face, or making a healthy skin. So in that way, we have to rule out the factors. Why age related, that's okay. We can support through medications. But other than age related, if these are the factors internally, which is affecting your skin or health, that should be cleared first. So for that, we can take internal medicines, which can help your skin detoxification, like Mangista will be helpful in that case, and externally therapies to relieve the stress, like Shirodhara can be helpful, Shirolepam can be helpful, and the proper maintaining the diet and lifestyle. And external applications also, we can suggest based on the need of the patient. All external applications can help them to fulfill the criteria. Then external applications also can be given. If you feel internal factors are also the contributing ones, then definitely you have to work out on the internal factors to get the result external.
Okay. Thank you, Dr. Sameera, for sharing such simple and practical Ayurvedic wisdom with our listeners today. Your insights beautifully remind us that health is not just about treatment, but about the way we live every single day. And ancient Ayurvedic scholars believe that health is not built only in the doctor's clinic, but in our daily routines. So, thank you, Dr. Sameera, once again for joining us and guiding our listeners through the different phases of women's health with such a clarity and care. And all of you who joined us for this webinar, thank you for listening. Stay tuned for our next series of She Matters, where we will be exploring physiotherapy, strong body, stronger you, from motherhood to active aging. This upcoming session will focus on how physiotherapy can support women's strength, mobility, and overall well-being through different stages of life by Dr. Surekha. Until then, this is Dr. Swapna signing off. Stay tuned and stay healthy. Thank you.